A nagyobbik fiam betegsége kapcsán 2003-tól 2005-ig
Between 2003 and 2005, due to the illness of my older son, I gained reasonable experience in researching scientific literature. It was necessary because when my older son Gábor was born, he cried continuously and must have been in severe pain, and we couldn't find a reason for it. He was thoroughly examined for a long time in the Munich Children's Hospital. Even metabolic tests were carried out on him, and they could see that a large amount of water was leaving his body.
jön ki a szervezetéből.
But the examinations of that time did not recognize that this was a case of diabetes insipidus, meaning that there were not enough water hormones in his body, and, as a result, he was probably suffering from pain in his kidneys. One of the doctors admitted that later. The end of chromosome 22 is missing in him, which is called Phelan-McDermid syndrome, or 22q13 deletion syndrome, which has its own characteristics. The most important characteristic is that mental development stays at the level of a 1 to 2-year-old, with severe behavioral disturbances and symptoms of schizophrenia.
Tapasztalható nagyon súlyos magatartászavar, skizofrénia tünetek.
And the gene that is one of the culprits in this issue, the SHANK3, is one of the most thoroughly researched genes within the field of autism, schizophrenia and depression. This gene is related to all of them.
És nyilvánvalóan nagyon sokan úgy gondolják, hogy
And obviously, a lot of people believe that if they could solve the issues caused by the deletion, absence, or anomaly of the SHANK3, they would find a cure for a huge range of psychiatric diseases.
pszichiátriai betegségre gyógyírt találnak. Annak idején még nem lehetett tudni 2000.
At the time, around 2004 to 2005, it was not known that this SHANK3 gene, or the protein coded by it, is such an important gene, even for healthy people too. At that time, I only noticed that this gene is connected to an element, a receptor, that senses one of the insulins. It was called IRSP53, which is not that important right now, but in Germany, the first clinical trial was carried out on healthy individuals who were administered big doses, 160 units of insulin nasally.
Akiknél orron keresztül inzulint adagoltak, nagy mennyiségben, 160 egységgel.
And these trials made it clear to me that they had no side effects and even reported positive effects. It was beneficial for memory, mood, and even had some positive metabolic effects.
Voltak pozitív metabolikus hatásai is.
At the time, my son had medications prescribed and administered that were not allowed for children, only adults. So it was clear to me that they were trying to help my child with medications that were not authorized to be used for children, only adults. But his pain was so severe that the doctors had no other option. This motivated and drove me to find procedures and methods for my son that would stop this pain, because even these medications were not effective enough. He was still in pain. And after some time, I realized that this was probably an extraordinarily severe case of diabetes insipidus, which could not be identified clearly because it came and went in waves. Sometimes his body did produce water hormones, sometimes it didn't. He either peed a lot, let out everything that he drank, up to 2 to 3 liters a day for a 2-year-old child, or he didn't pee at all for days. He hardly peed at all for 2, 3 or 4 days, which suggested that his hypothalamus, which is in charge of controlling these hormones, was totally unstable and wasn't working well. It couldn't control the production of hormones. And then I started giving him water hormones which did control his urine production and stopped the constant flow of water coming out of him, but did not have a good effect on his nervous system. So he became even more stressed, even more tense. On top of that, he had already been struggling with severe sleeping problems. He virtually didn't sleep for 2 to 3 years. He didn't have a good sleeping pattern. He slept 2 to 3 hours a day, but during the day, not at night. And then I realized that instead of the water hormones, perhaps the insulin could be supplemented in the brain, because probably he had an insulin disorder. One of the important insulin receptors was also damaged, because that's what the SHANK3 gene is connected to. And then I convinced the doctor at the time, one of the doctors at the Munich hospital, about the usefulness of this, and we started giving it to him, which led to a drastic improvement in his condition.
Ami drámai állapotjavuláshoz vezetett.
His sleeping pattern improved significantly. His severe pain and the constant crying stopped. And on the 21st day of the insulin treatment, he understood the first word in his life,
Megértette az első szót életében.
which was unforgettable because little Gábor was sitting in front of me when someone came to the entrance door,
Jött a bejárati ajtóhoz,
the gate outside,
és
and we said to each other that someone had arrived. And he stood up and ran to the gate, and we realized that he understood the first word, the first expression in his life. So it brought about an overall improvement in my son's condition. He learnt how to ride a bike. He could even control the bike. His sleeping issues became so moderate that although he couldn't sleep on his own, when someone was beside him and he sensed that, if you woke up 2, 3 or 4 times, he went back to sleep. He didn't get up and didn't leave the room either. And this was a very significant result, because until then, until we started using the insulin, we hadn't slept through a single night for years on end. Since then, it has been proven by 2 clinical trials that insulin can be useful and bring about significant improvements in this kind of disease, especially in people above the age of 3.
Különösen azoknál, akik elmúltak 3 évesek.
After we managed to stabilize his condition, I continued with my research of the medical literature, because I suspected that if medicine had not discovered that this disease could be helped in this way, then it probably hadn't discovered many other things either. And then I started looking into different substances, medicinal mushrooms, flavonoids. My various therapeutic procedures have become quite well known in Hungary, maybe the most well known in the field of alternative cures. The so-called Varga medicinal mushrooms are widely used in Hungary for diabetes, cancer and different inflammatory diseases. But the medicinal mushrooms were not able to produce significant results in the case of autism or traumatic brain injuries. And the limits of insulin therapy were also visible. Quite quickly, after 1 or 2 years, it was clear that you couldn't progress beyond a certain point with it. It was not sufficient to develop further after a certain point. So I had given up on ever being able to help him any more than that. It seemed that besides insulin, other substances couldn't improve his condition either. Until November 2017. Accidentally, I came across the Proinsulin C-Peptide, a relatively neglected peptide that is present in the human body in large quantities. And I started to be interested in its effect on the central nervous system.
És elkezdett foglalkoztatni ennek a hatása a központi idegrendszerre.
The background for this is that in November 2016, I was at a skiing holiday in Capron, Austria, and because I thought I could ski, I suffered a moderate traumatic brain injury. I can remember the previous day. I went to the ski grounds by car and skied through all of the pistes, the blue, the red and the black. The black piste was very, very slippery. I almost fell while I was on it, I remember that. And I thought that I had to learn how to slide down the black piste at high speed. And I know that the previous day I was planning to go up the black piste again, start right there and ski down several times, until I would learn properly how to ski down the black piste at high speed. Looking back now, that was a crazy thought because the black piste was at the height of about 3,000 meters, and it was completely frozen over. It was smooth as glass. It was a glacier piste, but I thought that I had to learn to ski at that level, at such a place as well.
Tehát szinte tükörjég volt, egy gletszer pálya volt, de úgy gondoltam, hogy ott is meg kell tanulni síelni ezen a szinten is.
I wanted to get to the next level. I thought I could ski. My last memory from the second day is that I was waiting for the bus that takes me to the ski lift of the piste.
Várok a buszra.
That's my last memory of the day, the beginning of that day, at least. And I don't remember how I went up that piste or how I came down. But it's obvious the results suggest that I reached the black piste and probably slid down it, but not the way I thought I was going to. Because I can't remember it, I only know from other people's accounts that I slid down the black piste and fell. I probably fell on my head, and for a short amount of time I was unconscious. 2 English women who escorted me off the piste told me this. They saw that I fell and that I was unconscious for a short time. And after that, I didn't know where I was.
Nem tudtam, hogy hol vagyok.
And I was trying to contact my partner to call her. What's very interesting is that I remembered the 4-digit code to unlock my phone. I don't understand that. And I also remembered who I had to call. But I didn't remember other things. I didn't know where I was. As I've heard, I had to look at my clothes to see that I was wearing ski clothes. And I had to constantly look at my surroundings to see where I was. And I gathered from that I was probably skiing. But I forgot all of that within 3 or 4 seconds.
Mind 3-4 másodperc után újra elfelejtettem.
Észrevettem, hogy 17 nem fogadott hívásom.
I noticed that I had 17 missed calls from Gábor, and when I called him, he was very cheerful, like, "Hey darling, how are you? Are you all good?" I said to him, "You called me 17 times, what happened?" "Oh, nothing, I just had a minor accident." And then I asked him what happened. "I don't know, but I think I fell over. But where am I, by the way?"
Én most hol vagyok?
3-4 másodpercenként újra kellett.
Every 3 or 4 seconds, I basically had to re-evaluate my situation and have another look at where I was, what clothes I was wearing, and what I was doing there.
És akkor mondtam neki, hogy hát eljöttünk síelni, családi síelésre.
And then I told him that we had come for a family skiing holiday. "Oh, that's right, I'm wearing ski clothes and it's winter." So this is how he reacted to it, which of course scared me quite a bit. And then I asked him where he was, and he said he didn't know. And then I learned that a member of a rescue crew was there with him, and then it turned out that he was on a mountain called Kitzsteinhorn. And then we went straight to the bottom of the ski lift and waited for him. During this journey, he called me at least another 6 or 7 times and said the same things over and over again on the telephone.
És ugyanazt elmondta a telefonba.
De erre én nem emlékszem.
But I don't remember these details. I only know from other people's accounts. My next memory is that I was lying in a hospital bed and I could sense that the other patients were looking at me with dread. And I didn't understand why, because I had introduced myself in a friendly way, but they were looking at me with scared faces, and I couldn't understand why they were not saying hi to me too. And I know only from accounts that this introduction happened several dozen times.
De nagyon örültek nekem a...
The nurses were very happy when I arrived because he told them the same thing, basically, every 5 minutes. When he saw me, the most interesting thing was that I was pregnant with our second child, and I had a pretty big belly then in November. It was around my birthday, around 17th November, and I had a big belly because we were expecting the baby, Christoph, in February. And the funny thing was that when he saw me, he said, "You're pregnant!" So it was a huge surprise.
Terhes vagy. egy ilyen hihetetlen meglepetés.
It was an interesting experience. I guess it was even more interesting for her. So I did not remember. I remembered that we had our first son, but I did not remember that she was pregnant with the next one. And I was confused. How could she... So I couldn't imagine that she would be pregnant with a second child.
And I was there with him for 5.5 hours, and during all this time, he only said about 10 sentences, constantly repeating them. So he was in pretty bad shape. And because he kept calling me all the time, the battery of his phone died, so I bought him a charger. But when I left, he still kept calling me, saying, "I don't have a charger, I don't have a charger." And then I said to him, "Stand up next to your bed. It's on the chair. Can you see it? How did it get there?" I said, "I was there visiting you. I just left." And then he always said, "Oh, really? I can't remember."
Ez az állapot olyan
This condition lasted for about 1.5 days, as far as I can remember. I sensed that I was able to keep memories for longer and longer periods of time. It was gradual.
Ez így fokozatos volt.
After 3 seconds, it was about 5 minutes, and then 10 minutes, 15 minutes, an hour, 2 hours, 3 hours, half a day. My memory expanded and was able to store more memories gradually.
The only thing he never recollected was the circumstances of his accident.
A következő évben, 2017-ben a jellemző...
In the following year, in 2017, I often forgot the different things I had to do on a given day. So I was forgetful. If I didn't write down that I had to go shopping and buy 5 or 6 things, not many, which previously I used to remember, then not only did I forget what I had to buy, but the entire shopping task itself.
Megálltunk egy benzinkúton Frankfurt felé, és leszerette volna mosni az autó ablakát.
On the way to Frankfurt, we stopped at a petrol station and he wanted to wash the windscreen of the car. He went to get the tools needed to wash the windscreen, but on the way he suddenly remembered something. I don't know, maybe he wanted to get something else from the petrol station, and by the time he came back, he had forgotten that he wanted to wash the windscreen. And then he went around the car a few times looking for the window cleaning tool, and I told him, "It's there." And he said, "It's not." And then we laughed a lot about it because the tools were indeed there next to the window, and I could see that it was there and that previously he was holding it in his hand, so I could see that interesting things were happening. Anyway, after about 2 months, he became more interested in how the brain could be restored.
I restarted researching the medical scientific literature in March 2017. What stood out to me was that the lower insulin level, fasting insulin level, someone or a society or an indigenous community had, the less civilization diseases, diabetes, high blood pressure, etc., occurred in them.
Tehát általában civilizációs betegségek.
This was the case, for example, in the Tarahumara people in Mexico. But these correlations were observed in some Pacific islands and certain African tribes as well. Those who consumed a lot of animal proteins had higher levels of it. And in Western society, if you look at the statistics over decades, the fasting insulin level is continuously rising, and it is probably associated with the dominance, occurrence, and spread of civilization diseases. For example, a high insulin level promotes an early sexual maturity in children, and the earlier sexual maturity is reached, the more likely it is that they later would not develop only diabetes, but also different types of cancer, prostate cancer and breast cancer as well. So our lifestyle is associated with the fact that various types of cancer, diabetes and obesity are more and more prevalent. And this is primarily the effect of animal proteins, easily absorbable animal proteins, primarily. Not necessarily of processed carbohydrates. Those are also harmful, of course, but we usually underestimate the role of animal proteins and saturated fatty acids in this process. There are many beneficial substances, mainly plant-based substances, that can counterbalance this. Obviously, you can live the longest with a vegan lifestyle, and that is the healthiest. So I got more or less to this point in my research when I came across C-Peptide. So I had also been very sensitive to the effect of insulin because of my son, and I already knew about C-Peptide to some extent. But then I first came across an article in which they wrote about C-Peptide being given to humans and animals. We're talking about a type 1 diabetes mellitus, where insulin is not produced, and where insulin is not produced, C-Peptide is not produced either. And the supplementation of only insulin in these patients couldn't fully prevent the deterioration of the nervous system. Neither the impairment of the central nervous system nor that of the peripheral nervous system, so it was very clear and simple to me that C-peptide significantly increases the nervous system protecting effect of insulin. This was a simple enlightenment for me, and it was crystal clear that C-peptide significantly improves or even surpasses the nervous system protecting effect of insulin. And physiologically, in a living human being, a living organism, C-peptide and insulin are always present there together, never separately. With the difference being that the half-life, the breakdown time of insulin, is 4 minutes, while for C-peptide it's approximately 30 minutes. So there is always much more C-peptide in the body than insulin, because it stays in the body for longer. The only question for me at that time was only that, okay, it's clear, we know that C-peptide is vital for the healthy operation of the nervous system, because if it's not there, the nervous system will be damaged after some time. The younger someone who's missing it is, the more damage is caused. So, in their laboratory tests, the researchers found that C-peptide cannot be overdosed. That is, if there is more than the physiological amount of C-peptide in a human body or any organism, the cells do not sense that. They tested this for about 3 types of cells. And this was, in retrospect, the scientific dogma that is still prevalent to this day. That there's no point in giving C-peptide to healthy people, in quotation marks, meaning those who produce C-peptide, everyone who produces insulin produces that too. So C-peptide is a part of the insulin, but it breaks off when the pancreas sends insulin to the human body. And so, according to the scientific dogma, there's no point in giving this C-peptide for any other issue apart from type 1 diabetes, because the human body doesn't detect it if there's more of it. My own example disproves this. It's not true. This may be one of the gravest scientific dogmas that has caused harm to the medical system, and because I've tried this C-peptide on myself.
C-peptidet magamon kipróbáltam.
Amikor Gábor rájött erre, hogy a
And then Gábor realized that the C-peptide can help with certain things. So he ordered this substance immediately. And he had to wait quite a long time for it to arrive because it's produced only in special laboratories. But by the time it arrived, he already had a recipe for the best environment in which this molecule should be placed and how it should be best applied.
hogyan lenne jó alkalmazni.
És akkor elkezdtem magam kezelni napi 1 mg C-peptiddel.
And then I started treating myself with a daily dose of 1 milligram of C-peptide for 7 days. From the very first day, I could sleep through the whole night. I remember that I administered 0.5 milligrams of C-peptide around 5 o'clock, and the following morning I had to be woken up. My sleep was so deep. This was unprecedented in the previous 6 months, and I had dreams. The previous year, I didn't have any dreams at all. So it promoted dreaming and a deep, relaxing sleep.
Volt az alvásom,
Then I gave it to myself for 7 days. My sleep continued to be good, and I tested my memory. I didn't note down any of the things that I had to do that day. I didn't make a specific list for the shopping, and I noticed that I remembered that I had to go shopping, although just not the things I had to buy. This was at 7 milligrams. And then when I was, I think, using 15 milligrams, I could go shopping without a list and could remember 6 things that day. Having to go shopping to buy 6 things to get 6 different things done, not in one place, but in 2 different places. This I could remember after I use 15 plus 7, that is around 21 to 22 milligrams, which is not such a big quantity because there's about 1.5 to 2.5 to 3 milligrams of it present in the entire human body at a given time. Obviously, a lot less if we just look at the brain. So this meant that the scientific dogma had been refuted. If we overdose C-peptide in the brain of a person who doesn't have type 1 diabetes mellitus, and so it produces insulin and produces C-peptide, it has a significant positive effect, which was obvious to me from the serious improvement in my memory and the quality of my sleep. It seems like the human brain is able to regenerate thanks to an overdose of C-peptide.
Regenerálódni képes egy túladagolt C-peptid hatására. Nagyon nagy élmény volt számomra egyébként.
It was fantastic to me because I knew that the brain of anyone who'd had a traumatic brain injury is much more sensitive to various inflammatory diseases, degenerates much more quickly, develops Alzheimer's, depression, and different severe brain diseases much more quickly.
Súlyos agybetegségek. Gondoljunk itt a focistákra vagy a sportolókra.
Let's think of football players, athletes, or boxers. Alzheimer's occurs very often in these cases, which is not a coincidence.
Hogy azok az emberek, akik
After using 21 milligrams, it was clear to me that giving it to people who had had a similar traumatic brain injury to mine could prevent the deterioration of the brain almost entirely, because it not only prevented the deterioration of my brain, but turned the process backward. So I can safely say that my memory, even my speaking skills, have become much better with the use of C-peptide than they were before my accident, and others have confirmed it too.
hogy legálissá tegyem a C-peptid használatát.
In order to make the use of C-peptide legal in some way, I've authorized it within the European Union. I've registered it as a deodorant and have, of course, used only non-toxic ingredients in this deodorant that do not harm the human body, which is unfortunately not apparent, because currently there are many sprays distributed as medication that are toxic to human cells. The regulating authorities accept them because the side effects are nicely listed, but they can be severe, especially for autistic people or children with brain diseases. So I have developed a spray that does not contain toxic ingredients, only C-peptide, and maybe other supplementary substances that help stabilize the C-peptide protein. And of course, I wanted to help my son with it too. We experienced a sharp improvement in his condition, in the quality of his sleep, his verbal comprehension, his communication, patience, and concentration.
A verbális megértésében, a kommunikációjában, a türelmében, a koncentrációjában.
Little Gábor is 16, as I have said, but he has never slept through a single night in his life. You can imagine what that's like. It's very difficult for him to fall asleep. He wakes up very early, and in between he wakes up several times, and it's very difficult for him to go back to sleep. So his sleep has always been very disturbed. It changed within days, in 2 days. And ever since then, he goes to sleep every day at 8, and in the morning he is woken up, I think, at 6:30 when he goes to school. So he sleeps without interruption until 6:30 in the morning and needs to be woken up. This had never happened before.
And what's shocking is that it works completely differently from insulin. The insulin had to be decreased gradually because it gave him more and more stress. So in the second year, we had to stop giving him insulin because it stopped doing him any good. It's the exact opposite with C-peptide. With a gradual increase of the dosage, the capacity of the human brain for regeneration also improves and grows gradually. C-peptide can effect drastic improvements in many conditions such as depression, schizophrenia, or autism, or the most frequent types of these. Obviously, it should not be assumed that it will help in every single case. I'm speaking about the majority of cases. Each disease is a little different genetically. It seems like the amino acid structure of C-peptide changed very, very fast during evolution. Insulin, however, is stable. We could live with a dog's insulin. There hasn't been much change between the amino acid composition of human insulin but there has been a significant change in the composition of C-peptide. Evolution must have used C-peptide for altering its amino acid structure until it could fine-tune the operation of the human nervous system, because it seems like C-peptide can, in the nucleus, coordinate the activities of all growth factors, both in terms of time and place. It strengthens connections in the brain through coordinating growth factors in the brain, and it probably corrects or attempts to correct the internal wounds that have occurred in the nervous system. It's probably not a coincidence that, in our experience, the C-peptide spray has a significant anti-inflammatory and regenerative effect in severe burn injuries as well.
Jelentős gyulladáscsökkentő és regeneráló hatással rendelkezik a C-peptide spray.
And how I imagine it is that the way C-peptide heals severe skin injuries, technically it creates a new skin layer or promotes its creation. The same way it also corrects and heals inflammatory injuries in the brain. C-peptide performs its effect only in the presence of the right amount of zinc. So if the level of zinc is not sufficient in the human body, then C-peptide cannot perform its optimal regenerative effect.
Regeneráló hatást kifejteni.
I'm a mother of two, and because the age difference between the two kids is 1.5 years, I think every mum knows very well that sleep is a very, very rare event. Deep sleep is even more rare, and I have felt such strong fatigue in the last 2 to 3.5 years that when I started using the C-Peptide, I did not believe that anything could take me out of it. It should also be noted that I weighed between 65 and 70 kilos, because everyone knows that when you're tired, the first thing that happens is you start eat. Because you have to supplement the lost energy somehow, and seemingly the most obvious thing is, of course, eating. On top of that, I didn't have the energy to do any exercise, not even a minimal amount. So if I stood on the treadmill because, okay, let's do some running, it was guaranteed that I had to stop after 15 minutes because I simply felt like collapsing. So if I went on the treadmill because, okay, let's do some running, it was guaranteed that I had to stop after 15 minutes because I simply felt like collapsing, and I had to drink 6 coffees a day to achieve a blood pressure of about 120. I asked if I could try it, and he said, of course. And after a few days, I noticed that I was much less tired. And you cannot possibly imagine how much more energetic I felt. I am naturally very active, and if I wake up in the morning and have a certain amount of energy generated through the night's sleep, I use that up quite quickly. But now that I'm using it in the evenings, I almost feel like I could still run around the house, that I'm really quite full of energy. So I don't have any difficulty falling asleep. It helps in a lot of things. It energizes, but it doesn't push you awake, if that makes sense.
It's very interesting that if this peptide is present in big quantities, for example, in a pre-diabetes state, if a lot of insulin is produced and the pancreas hasn't stopped producing insulin, then the likelihood of a benign brain tumour is much lower. The likelihood of meningioma, neurofibromatosis, glioma, or glioblastoma is much lower in people who have a high C-peptide level. This has been clearly shown in epidemiological surveys. Researchers have no idea why. No one has thought of C-peptide, because insulin itself is carcinogenic. A high blood sugar level is in itself carcinogenic. And that's why researchers don't understand why there's a high insulin level, which is usually coupled with a high blood sugar level. The likelihood of brain cancer is lower. And the next logical step could be that it's because the level of C-peptide is high as well.
És itt lehetne a logikus lépés az, hogy azért, mert ott nagyon magas a C-peptid szint is, és olyan erős a C-peptid.
And the anti-brain cancer effect of C-peptide is so strong that it can be measured in that wherever the C-peptide is high, the likelihood of these brain tumours is much lower.
Sabi was born with hypotonic musculature, and we tried to look for different solutions. This is how we came across the C-Peptide deodorant through an acquaintance, and he has developed greatly. I started using it and my hearing came back. My joints have also been better since then. I now move much more easily. I noticed a huge change after 3 days, as if the disease had been switched off. And that was a shocking, incredible experience for me.
The CT image showed that the metastases have technically disappeared. The tumour in my lungs has shrunk to less than 1 centimetre.
1 centinél kisebbre zsugorodott.
My brother-in-law also asked, what has happened to you? He said I should join the military.
C-Peptide is very, very good at healing burn injuries. The CT scan found that the tumour in my spine shrank to 15 millimetres with a constitution of part air and part soft tissue, and the neurosurgeon told me that it did not require further treatment.
Nap mint nap tapasztaljuk a visszajelzések alapján, hogy
Through the feedback we get, we are learning every day about the improvement in more and more surprising medical issues, thanks to the C-peptide deodorant. The last feedback was about severe breathing issues, asthma. It makes the disease virtually asymptomatic.
mentessé teszi ezt a betegséget, de ugyanúgy Számomra meglepő.
But it's equally surprising and incomprehensible to me how the C-peptide deodorant can make myasthenia gravis muscular dystrophy asymptomatic.
Több esetben is visszajelezték.
We have received this feedback several times, even in very severe cases. This is almost incomprehensible to me, and if I hadn't seen it with my own eyes, and someone else had told me, I wouldn't believe it. What it can do seems so incredible to me too. A common peptide, a peptide that is, you could say, the most common peptide in the human body, is constantly produced and is constantly present in large quantities.
The information in this video has not been evaluated by the Food and Drug Administration or any other medical body. We do not aim to diagnose, treat, cure or prevent any illness or disease. Information is shared for educational purposes only. You must consult your doctor before acting on any content on this video, especially if you are pregnant, nursing, taking medication or have a medical condition.